Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be having a conversation with Dr. Milan Radovich. He's joining us from Caris Life Sciences. You know, President Biden recently announced a multi-faceted cancer pledge with the goal of reducing mortality from the disease by 50% during the next 25 years or so. Well, Dr. Radovich is Senior Vice President and Chief Precision Medicine Officer at Caris Life Sciences. He's joining us here this morning to discuss precision medicine and why some treatments work well in some patients, but not so much in others with the same diagnosis. Welcome to Health Professional Radio. Dr. Radovich, thank you for taking the time.
Well, good morning. It's a pleasure to be here. Thank you.
Well, give our listeners a bit of a background. Tell us a little bit about who you are and talk briefly about your role at Caris Life Sciences.
Well, thank you so much. I'm the Chief Precision Medicine Officer here at Caris. Been here roughly 4 months and have the pleasure of leading a large team dedicated to advancing how we use technologies to guide therapy for patients. So how we use cutting edge, particularly genomic technologies, to figure out what makes the cancer tick and be able to find the right drug to stop it. In this role, I lead a large team, including a team dedicated to identifying new drug targets. So learning how we can develop better drugs to attack this disease. I also lead a large team dedicated to looking at the most cutting edge evidence that comes out in the literature to determine what are the best biomarkers that we can use to guide therapy for patients. And also actively involved in our research and advancing our technologies to better treat and diagnose patients, but also being able to learn how we can use these technologies to detect cancer at its earliest stages. So quite a multifaceted role and one that is quite fun and a very exciting time.
When we're talking about precision medicine, especially in oncology, what exactly are we talking about, and how is Caris Life Sciences specifically advancing to the next era of cancer treatment?
So cancer, in essence, is a disease of DNA. It's caused when there's a typo in the DNA blueprint of a normal cell that causes that cell to go haywire and become cancerous. And what we've been able to do through advances in cutting-edge technologies is being able to scan the DNA of cancers, figure out what's all gone haywire, and match the right therapy to it. And we call this precision medicine, tailoring therapy to the individual makeup of each patient's tumor. And the reason we do this is we realized over a long period of time in oncology that if you take a group of patients with the same diagnosis and treat them all with the same drug, not everyone gets the same response. Some patients do well with a particular drug and some don't. So here in precision medicine, our goal is really to use cutting-edge technologies to guide patients to the right drug for their cancer. And what we've also been able to do with that same technology is be able to develop novel drugs that go after very intricate mutations or very specific mutations seen in subpopulations of patients. So we really, as a field, really want to make sure that the patients are getting the right drug for their cancer at the right time. Here at Caris, we really pride ourselves in creating what I call are the best battle plans for how our doctors can guide therapy for their patients. We use a very comprehensive genomic approach where we look at every single gene in the genome, both at what we call the DNA level, so at the blueprint, and also at the RNA level, which is the message of that blueprint, to leave no stone unturned in identifying the right therapy for the patient. So we pride ourselves in the fact that if there is a drug, either FDA approved or in clinical trials, we're going to be able to find that drug for that patient if their tumor will be predicted to be sensitive to it. This, I think, provides a lot of peace of mind knowing that our patients have every option available at their disposal to be able to attack their cancer. We also pride ourselves in advancing the field. We're doing a ton of research at Caris, utilizing the data that we've generated, like I mentioned, to, for example, develop new drug targets and to develop new assays where we are going to be able to use this technology to do things like detect if a patient's cancer is going to relapse. And even further, earlier in the course, being able to detect cancer at its earliest stages, because what we know is that the number one way to survive cancer is to catch it at its earliest stages, and we want to use the best technologies on the planet to do that as well. So again, a comprehensive approach of using molecular profiling all the way from guiding therapy in the later stages all the way to detecting cancer at its earliest stages.
You mentioned later stages. Is Caris positioned to track these patients, to monitor drug reactions in different patients with the same diagnoses over a long period of time so that maybe your approach can evolve with those results?
No, it's a great question. And what we know is that cancers do evolve in the face of therapy. Unfortunately, this disease is extremely smart. It learns how to adapt to particular therapies. It does that by actually changing its genome. in its transcriptome. So it's changing its DNA and RNA to become resistant to a particular therapy and developing new ways for it to do what it wants to do, which is it wants to grow and it wants to survive. And so here at Caris, we do. We do engage in what we call longitudinal sampling. So this concept of continuing to analyze the tumor over time to see how it changes. Traditionally, that's been done by tumor biopsy, where we get a sample of the tumor and sequence it. However, the newest methodology is actually to do it with a simple blood sample that we call a liquid biopsy. Mm-hmm. And this is a really powerful technology where we can just do a simple, non-invasive blood draw, use really sensitive sequencing techniques, and be able to detect the tumor makeup from a simple blood draw. Well, as you can imagine, that makes it really amenable to monitoring and to be able to do this longitudinally. Mm-hmm. And what we're seeing in the field is that we're actually able to, in some cases, actually detect whether a cancer is progressing or responding before imaging, before a CT scan can, by being able to look at changes in the DNA makeup via the blood. So, yes, we're very engaged in this and very excited, and I think this is going to be an evolution of the field moving forward.
Now, as I mentioned, and as you know, President Biden just reignited the Cancer Moonshot program, talking about exactly what you're researching and developing there at Caris Life Sciences, strategies to develop treatments for some of these cancers. I'm saying that, we're not targeting the right treatments to the right patients, but of course, you're talking about doing just that at Caris Life Sciences. Are you working within some of those parameters in that particular program?
Yeah, we are. I mean, we do that by obviously advancing our technologies. We partner with numerous academic groups and clinical trials organizations to really advance the technology and make it applicable to our patients, particularly in the context both of clinical care, but also in clinical trials. And so in line with the Moonshot, heavy efforts, again, in using cutting-edge technologies to guide therapy. What we're seeing in the field, and I believe, and as the Moonshot also alluded to, the field has really moved also beyond this concept of one gene equals one drug to this concept of how we use artificial intelligence to understand patterns and how we can utilize those patterns to actually find the right drug for a patient. So instead of one gene equals one drug, it could be hundreds of genes equals a particular drug or a drug combination. And this has been a really powerful approach of recent times where we let these artificial intelligence algorithms utilize data and help us guide what is the right drug for the right patient.
You talked about being very excited about the future as far as research is concerned, research and development. What would you say is the one thing that you're most excited about as far as trends are concerned and how cancer is screened, diagnosed, and treated?
That's a very high bar question, and one I'll answer briefly, but I would say probably three things. I think when it comes to treating later stage disease, I think our therapies will continue to become hyper-personalized. And what we're seeing in the field is development of drugs that go after mutations that were thought to be undruggable, for example, and also going after mutations that are very unique to each patient's makeup. So, for example, think about being able to program immunotherapies that are specific to a patient's cancer and being able to reprogram their immune cells to go after those cancers. I think this is really, on the tip of the spear of how we're going to treat advanced stages. When it comes to early stage cancers, the area I'm most excited about is this concept of what we call minimal residual disease. And this is a concept of that if you have a patient with an early stage cancer, so stage 1 through 3, and they've completed chemotherapy and surgery, we can use a simple blood test to detect if cancer is still in the circulation. And if it is, we know that those patients are at high risk of their cancer coming back. Versus if it's negative, we know that those patients are probably long-term going to do well. Unfortunately, if it does come back, these cancers typically come back with a vengeance. They tend to come back at stage 4. You can be very aggressive. And so what we're seeing in the field is that if we can detect these patients who are at high risk of relapse, we can actually intervene with novel therapies and actually stem that relapse from happening. So there, I think we're going to save lives. I think we're going to cure more patients by being able to identify these high risk of patients who are at high risk of relapse and intervene with therapy. And then the third is going to be early detection. I think we're going to see the biggest inroads initially in high-risk groups. So patients who, for example, maybe carry a genetic predisposition to developing cancer, like BRCA1 or 2, or maybe folks with a variety of other high-risk factors, whether that's extensive exposure to sunlight or smoking or whatnot. But we're going to be able to detect their cancers earlier. But then I think overall, as a field, we'll eventually get to the point where getting a blood test to detect your cancer will be just like you going into your doctor to get your lipid test. or your annual physical. And we're going to be able to catch these things at the earliest stages, hopefully being able to maybe just treat it with simple surgery or simple procedures, and then folks can just go on with their lives and not have to worry about the fear of this thing evolving into something that's uncontrollable. So I'm very excited for this. I hope and pray in my lifetime we're going to see a dramatic drop in the mortality due to this disease.
Give us a website where we can learn more about Caris Life Sciences, please.
Sure. Please go to carislifesciences.com, where you'll be able to learn a ton about what we offer to our patients and what we're doing in advancing the field.
Dr. Radovich, I appreciate your time this morning here on Health Professional Radio. Thank you so much.
Thank you so much. It was a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Milan Radovich. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.